So we'll go ahead and finish up talking about HHS, and then if you guys have any questions or anything, I'll be more than happy to attempt to give you guys answers. Unfortunately, a lot of things we just don't have answers for. I'd rather say I don't know than to say something that's just not right. Really scattering. Yeah.
So you do have answers.
Well, some limited. I have more questions than I do answers, unfortunately. All right. So.
Sorry.
Oh, okay. Look at him. Shame him, please. Shame him. No. So how are you guys? Are you guys reasonably good with DKA? Does that kind of make sense there?
Yeah.
What goes on there? Okay. So now what I want to do is I want to talk about this weird HHS thing. This hyperglycemic hyperosmolar syndrome, where they're not acidotic or anything. So HHS is a weird thing. And what happens in HHS is this can happen with type 2 diabetics, or it can happen, in some cases, it can happen with people that aren't diabetic at all. They just get really sick, and we'll talk about kind of what goes on there. But we can say that it's your type 2. So what happens is there's some sort of event that causes your blood sugar to increase. And we'll talk about what some of those events may be. So you have an increase in your BGL, but you're type 2 diabetic, so are you making some insulin?
Yes.
So sugar can get into the cells. Okay, some glucose can get into the cells, so do the cells starve? They're not starving, so they don't send the chemicals out, the signals out that tell the body, you better start breaking down some fat because we need to get some acetyl-CoA in here now. So the body doesn't break down fat. It doesn't need to because the cells are getting enough energy. But what's happening is the blood sugar is rising rapidly, or gradually, if the case may be, and it's rising faster than the cells can deal with it. And it continues to rise, and it continues to rise, and it continues to rise unchecked. So do you think that this takes a while to develop?
Yes.
It actually does.
Yeah.
HHS can take several days to develop. Whereas DKA, generally, within a day or so, you can develop DKA. So DKA is a pretty rapid onset. Because with DKA, your cells just aren't getting that glucose. So your body's going to start breaking down those fats pretty darn quick. Whereas in HHS, they are getting some sugar. But what's happening is the sugar is just rising much higher than the body can deal with. So what ends up happening is you have a really, really high blood sugar, but you don't have any ketones. But let's talk about what happens when you get a really, really high blood sugar. Do you start spilling that out in your urine?
Mm-hmm.
Do you start losing water? Mm-hmm. Yes. So when it comes to DKA and HHS patients, both patients are going to be profoundly dehydrated. Is that good as far as our treatment goes? As far as making decisions?
Well, yeah, that's
It is.
You can add to it.
There you go. It is, because when you get into that patient's house and you're going, is this DKA or is this HHS?
Treatment's the same.
There you go. You don't have to necessarily make that call. You can go, I don't know, but it's one of those two. The sugar's really high. How am I going to treat it? I'm going to hit them with the fluids. That's a cool thing. I mean, it's not cool that these things happen, but that's a cool thing for us is we don't necessarily have to differentiate between these two because it can be pretty hard to differentiate. But in general, HHS tends to develop more slowly. Takes a while for that sugar to get up there. The patients in HHS may not have all the other signs and symptoms. They're not going to be acidotic, so they may not have the Kussmaul's respirations like you would see in your DKA patient. Now, with the fruity acetone breath, some DKA patients don't have that anyway, so that's not reliable one way or the other. If they have the fruity breath, though, that's more suggestive of DKA, not HHS. And an interesting thing about HHS is this can happen with patients that are not diabetic. And it tends to happen in patients who get really sick. They have some sort of severe illness or injury that can cause this to happen. One of the things that can cause this to happen is an inflammation of the pancreas, something called pancreatitis. People that get pancreatitis, they may be at higher risk for developing this HHS syndrome. The good thing is the pre-hospital treatment is going to be pretty much the same. Sometimes with these HHS patients, their sugars can be much higher than DKA, and their sugars can be so high that they can have really severe neurological impairment. So they may have more respiratory, more cardiac, more neurological issues. You may end up having to bag them or take over their airway. They may have more severe neurological signs and symptoms than your DKA patients. Both patients are really sick though. Both patients we treat the same way with a bolus or a large amount of fluid in a small amount of time. 20 milliliters per kilogram is a pretty good starting point for these guys as well. So that's that as far as HHS goes. Just some other odds and ends that can cause blood sugar problems, both in both DKA and HHS. Infections can also cause this. Infections tend to cause our blood sugars to go up. And what happens is, anytime the body is placed under stress, you think about this, when the body's placed under stress, what happens? What happens to our body?
It uses more energy.
Okay. Which branch of the nervous system is activated? There's a sympathetic response. And that sympathetic nervous system releases norepinephrine and epinephrine. And the interesting thing about these hormones is they cause our sugar to increase. They cause our blood sugar to increase. And that's a good thing because your sympathetic nervous system is not evolved. It is not evolved to save us while we're dying in the ICU. That's not what our sympathetic nervous system was really evolved to do. It evolved on the plains of Africa, right? Where we were running from lions and tigers and bears, oh my. That's what our sympathetic nervous system was designed to do. It was a fight or flight machine, and if I'm getting ready to fight a tiger, I need to make sure that I have an adequate amount of sugar available for my cells, right? Because I'm in for a fight, or maybe I'm going to run away. I'd probably run away. I don't have a whole lot of pride when it comes to self-preservation. I really don't. I might be running away, but whatever the case may be, the sympathetic response will cause your blood sugar to increase. Along with that, your body can also release steroids, which come from the adrenal gland as well. And steroids can cause your blood sugars to increase as well. So when diabetic patients particularly, when they get sick, when they get injured, or when there's some sort of severe stress that causes a sympathetic response or a stress response, they are going to be at higher risk for developing things like DKA. There'll be much higher risk for hyperglycemic problems. So don't always assume that it's somebody who's non-compliant, although in some cases it is. But in a fairly large percentage of cases, it's actually an infection. So with that said, if some sort of other cause, an infection, an injury, or what have you, precipitated the DKA, what do you guys need to be looking for on your DKA or HHS patients? If you suspect that's going on, what should you be looking for?
Increased temperature,
Okay.
fever, just considering treatment to see if you can fix it.
Yeah. You want to be looking for that. Will you want to listen to your patient's lungs?
Sure.
You want to listen to their lungs. You want to get a history like, hey, what's been going on the past few days? Do they have a history of a cough? They cough and fever and chills, and what does that lead you to? Okay, maybe they have a pneumonia, and maybe there's some underlying lung problem. Maybe they have a urinary infection. Maybe they had some sort of injury, or maybe some sort of outpatient procedure, something like that.
If they're alcoholics.
They're alcoholics, yes. Right? Alcoholism, chronic alcohol use, can cause a type of ketoacidosis. It's not DKA, but they can get malnourished, and their cells can get malnourished, and they can have this breakdown of fat as well that occurs. So absolutely, and alcoholics are at higher risk for pancreatitis, right? It increases your risk for pancreatitis. So when you have these problems, make sure that you consider, okay, does this guy have an infection, guy or gal? Is there an infection? Is there some other problem going on? Because you may be the ones that will help make that call. Because I'm sure you guys have had to deal with people in hospitals, right? Sometimes they get a little cranky. Sometimes they're not necessarily thinking about the patient. If I'm an ER nurse and I have 5 patients, and you guys are bringing me another damn patient, okay? Do you think I might necessarily be giving a crap about the big picture? No, but like, nah, put him in bed. I'll get to him, whatever. And you might say, hey, this looks, this is what I'm assessing. This looks like a DKA, and I hear crackles in the right lower lobe. I think this patient also has a big pneumonia, and that may have been what caused the DKA. You can convey that information to me in my apathetic state. I may go, huh. And then I'll tell the physician that, hey, doc, this is what the EMS found. If there are crackles here, there's a fever, this patient may have an infection. What do you think the doc's going to do? Okay, well, while we're taking care of the DKA, let's go ahead and get a chest x-ray. Let's run some blood work, and maybe we can identify that infection sooner and take care of that. So believe it or not, the information that you guys gather can make a really big difference to how patients do. I'll tell you right now, really simple things can get overlooked in hospitals, and I'm sure you guys have even seen that happen. Blood sugars get overlooked in hospitals. Okay, there have been cases where a nurse was taking care of a patient who came in altered mental status. Okay, the guy was very lethargic. That guy sat in the ER for 2-3 hours before somebody drew blood, and the blood sugar is 40. That's what a horrible thing. What a horrible thing to allow to have happen. So sometimes you guys can make such a big difference by just assessing and then being aggressive about conveying that information, saying, no, this is what this looks like going on, and this is why. So with that said, guys, that's all I have as far as